Good afternoon and a warm welcome to our audience. I'm Dr. Madhusmita from 2050 Healthcare. Obesity presents a pressing challenge for women's health in India, with recent data indicating a substantial rise in obesity rates among women. According to the National Family Health Survey data, obesity prevalence among women aged 15 to 49 has nearly doubled from 12.6% in 2005 to 2006 to 22.9% in 2019 to 2020. This session aims to explore the health ramifications of obesity on Indian women, considering its links to diabetes, cardiovascular diseases, reproductive health issues, mental well being, and the broader societal and healthcare context. Through collaborative efforts, we strive to implement effective strategies for obesity prevention and holistic women's health promotion in India. Today, we have with us Dr. Kavya BN, a seasoned senior physician and diabetologist, to our esteemed gathering today. With a rich professional background spanning over a decade, she brings forth a wealth of experience garnered from diverse healthcare environments, including hospitals, clinical settings, primary care, and teleconsultation services. Her expertise extends to managing a spectrum of metabolic disorders, reflecting a deep rooted commitment to advancing patient care and wellness. It is our distinct honor to welcome Dr. Kavya BN, a seasoned senior physician and diabetologist, to our esteemed gathering today. With a rich professional background spanning over a decade, Dr. Kavya brings forth a wealth of experience garnered from diverse healthcare environments, including hospitals, clinical settings, primary care, and teleconsultation services. Her expertise extends to managing a spectrum of metabolic disorders, reflecting a deep rooted commitment to advancing patient care and wellness. We are eager to benefit from Dr. Kavya's insights as we delve into the critical aspects of obesity, women's health, and metabolic disorders in our discussion ahead. Welcome, ma'am. Ma'am, my first question for you is what is obesity?
According to the World Health Organization, if the body mass index, also called as BMI, measured as weight per kilogram per meter square, if it is greater than 25, then it is considered as overweight. Whereas if the BMI is equal to or greater than 30, it is considered as severe obesity. If it is greater than 35, it is extreme obesity, while greater than 40 is called as morbid obesity.
Thank you, ma'am. Ma'am, as we are aware now what is obesity, could you also elaborate on how does it impact women's health differently from men's?
To start off with, obesity is more prevalent in women than in most countries. Women compared to men are also likely to seek out and obtain all types of obesity treatment. In women, the hormones estrogen and progesterone varies when a woman is on the obese side. So because of that, being obese definitely affects women in a different way than in men.
Thank you, ma'am. Now, moving on to the next question. What are the major causes of obesity in women?
Causes, some of them are same for both men and women, whereas in women, the most important being lack of physical activity, unhealthy eating behaviors, poor quality of sleep, stress, health conditions like hypothyroidism and Cushing's, genetics, they play a major role too, and medicines like steroids.
Thank you, ma'am. What role does obesity play in the development of chronic diseases such as diabetes and cardiovascular diseases in women?
They have a major role to play, most importantly, starting off with dyslipidemia or the high cholesterol levels. These high cholesterol levels settle in the inner portion of the blood vessels, leading to what is called as the atherosclerosis, which leads to hypertension. This hypertension further affects the heart, leading to coronary artery diseases, which can cause conditions like your MI. This alteration in the fat levels, the excess fat gets deposited in the liver, leading to a condition called as non-alcoholic fatty liver disease. This non-alcoholic fatty liver disease then progresses on to cause fibrosis of the livers and hepatocellular carcinoma or the cancer of the liver. Obesity also causes increased insulin resistance, which leads to diabetes. Another thing that we can see is the cholelithiasis or the gallbladder stones. Female sex, obesity, and multiparity, that is having more than 3 children, in itself is a risk factor for gallbladder diseases. Also noticed is that rapid loss of weight causes cholelithiasis. Next, they also cause micronutrient deficiencies. That is because of the aberrations or problems in the absorptive, hormonal, and metabolic functions. Obesity also causes cancers in long terms like the endometrial, breast, and colorectal cancers in females. Kidney health is affected as they reduce the glomerular filtration rate or the ability of the kidney to put out urine, leading to end-stage kidney diseases and nephropathies. In lungs, it causes reduction in lung volume, and obesity is very well known to also cause the obstructive sleep apnea. Very much more specific to women is also the venous thromboembolism, that is clotting of blood within the blood vessels. It is also because of the imbalance in the estrogen and the progesterone hormones along with obesity that the chances of having thromboembolism is more.
Thank you, ma'am. Ma'am, as we are aware that PCOS is one of the most common syndromes which are present in the females today. So, what do you feel is the relationship between PCOS and obesity? And how does obesity affect the management and symptoms of PCOS in women?
So let's start off with what is called as the PCOS. As we all know, PCOS is a metabolic disorder characterized by hyperandrogenemia, that is, increase in the testosterone levels in females. This is often associated with other metabolic disorders like the insulin resistance, hyperinsulinism, impaired glucose tolerance, and obesity. What happens in this condition is that the excess adipose tissue, which is there, causes cessation of the follicle growth in the ovary. Once this happens, the egg does not get released from the ovary. This is called as anovulation. This anovulation leads to menstrual cycle disorders, right? There can be delay in periods or there can be more periods. So most probably it is the oligoanovulation leading to menstrual cycle disorders. PCOS and obesity, they form a vicious cycle. So if PCOS is there, the women tends to have to be on the overweight side or tend to have obesity. And when obesity is there, it again worsens PCOS. What has also been noticed is that women with PCOS, if there is weight loss, then the androgen level definitely decreases and it also improves the insulin resistance.
Thank you, ma'am, for explaining it. How does obesity affect reproductive health and fertility in women?
Moving on further, infertility is called as the lack of pregnancy despite regular unprotected sexual intercourse for a year. In obese women, the duration required to achieve this spontaneous pregnancy rate is increased. This can be because of the anovulatory infertility, like I just explained, and also the alteration in the endometrial environment affects its receptivity to the embryo. Poor embryo quality is also noticed. Further, obese women have associated disorders like hypothyroidism, diabetes, which again contributes to infertility in their own ways. What has been noticed in a study is that the risk of miscarriage was around 38.1% in obese women, while the rate was around 13.3% in patients with normal BMI.
Thank you, ma'am. Moving on to the next question. How does obesity during pregnancy affect maternal health, and what are the potential risks for both the baby and the mother?
Maternal obesity can result in negative outcomes for both women and the fetus. The maternal risk during pregnancies include gestational diabetes and preeclampsia. Not only that, there is an increased rate of operative delivery that leads to increased risk of intraoperative complications such as infections and thromboembolic events, and also an increased risk of anesthetic complications. Coming to the fetus is at risk for stillbirth and congenital anomalies like the fetal macrosomia or a big fetus and neural tube defects, that is defect in the central nervous system or the spinal cord for the baby. So women, when they are obese during pregnancy or the babies, when they are born to an obese woman, they do also tend to have problems later in life because both the mother and child can go on or continue to have problems like diabetes and hypertension, which can further lead to heart diseases.
Thank you so much, ma'am. How can obesity affect mental health and body image perception in women?
This is a very important topic, especially in today's generation. Obesity is associated with significant psychosocial burden. Most obese women struggle with issues related to their mood, self-esteem, quality of life, and body image. Disordered eating is the most common among persons with obesity. The most common being the binge eating disorder. Binge eating disorder is characterized by the consumption of large amount of food in a brief period of time, say less than 2 hours, during which the individual experiences a loss of control. Smaller percentage of the patients with obesity also have bulimia nervosa. That is binge eating, which is accompanied by self-induced vomiting or other compensatory behavior such as excessive exercises. Around 5% of these people also suffer from night eating. That is, they tend to eat more often in the night. They wake up from sleep to eat it. They're almost 5 times more likely to have an episode of major depression as compared to those of average weight. Obese women also tend to have social anxiety because of their perception, society's perception of how, as to how a woman should be, that is well within the normal BMI.
Thank you, ma'am, for answering that question. Moving on to the next question. How does obesity impact bone health in women, and what measures can be taken to mitigate the risk of bone related complications associated with obesity?
So, obesity adversely affects bone health by alteration of the bone regulating hormones and causes inflammation and oxidative stress. This oxidative stress and inflammation leads to the alteration in the bone quality, leading it to be more stiff or fragile. There is also a decline in the bone formation and increased risk for fracture in such states. Not only that, in women, there is also the post-operative complication. So once the patient has undergone a surgery, the complication also seems to be prolonged because of the longer hospital stay and longer time of recovery post-fracture.
Thanks a lot, ma'am, for explaining that. Moving on to our next question. What strategies are most effective in preventing and managing obesity in women?
The treatment of obesity, not only does a person needs to lose weight, but they should continue to maintain this lost weight. So the idea would be roughly to achieve 5% weight loss over a period of 6 months. This can be achieved through nutritional therapy. So every person needs a certain amount of calorie depending upon their age, their weight, as well as the type of work they do. So if you are, a person, a woman with 50 kilograms of weight, and if you are having a sedentary lifestyle, the requirement of calories would be roughly around 1,800. So if you want to lose weight, then you must be going towards a calorie deficit diet. You can always take help of fitness trainers or a person who can individualize your dietary plan so that you don't have alteration in your micronutrients, but at the same time you can maintain your you can have a calorie deficit diet and continue to maintain the weight that is lost. Exercise and physical activity becomes important. Around 150 minutes per week of moderate aerobic physical activity is what is recommended by WHO. Right? And physical, psychological, and behavior interventions also become important, because if the patient is having depression or if the patient is having any, eating disorders like we just discussed, if we try, to lose this excess weight without treating the psychological part of it, then it is going to be very difficult. So psychological and behavior intervention and treating of mental health before trying to lose weight also becomes very, very important. After all these lifestyle changes comes the pharmacotherapy, where you can use medicines in the form of tablets or in the form of injections like semaglutide, which is approved by the WHO for reducing weight. But there are certain criteria which needs to be, monitored and checked by your physician before such treatment can be started. After pharmacotherapy comes the surgical interventions. Surgical intervention is only advised for people who have severe obesity or morbid obesity, that is a BMI of more than 35. Here, changes are done to the digestive system. Either there is restricted in the quantity of food, or in the absorption, changes in the digestive system to reduce the absorption is done, and that is also referred only if patient is morbidly obese.
Thank you, ma'am. You have just spoken about the pharmacological indications and the drugs which are used to manage obesity. But do you feel there are any side effects of anti-obesity drugs like semaglutide on women?
We can only take if the patient is not having any gallbladder disease, is not suffering from pancreatitis or thyroid cancers. And even while transitioning, from the dosage, the dosage is increased over a period of 1 month. It started off in a minimal dosage and then it gradually increased. So even during the change, in the dosage form, you can expect some amount of gastrointestinal disturbances, which should be looked out for. And patients can also end up having some endometrial or breast cancers. So yes, women should look out, get checked by a physician if it is okay for you to take this medication before doing so, and be under the guidance of a physician.
Thank you, ma'am. This is the last question, I think, and one of the most common ones you would have heard. So, if you could talk about the recent diet trends and their effectiveness in weight management.
Intermittent fasting is like you exactly said, a lot of people are following that trend. Does it help in weight loss? Yes. But intermittent fasting should be only used for losing of weight for a shorter period of time. So, you can do it for a period of, say, a week or two, and then it should be stopped. Then you need to continue to try to maintain this lost weight. Okay. Why should we not continue to have intermittent fasting? Because it starts affecting the inner lining of your uh, stomach, which can lead to gastritis, which can further lead to gastric ulcer. So what happens in intermittent fasting is you are restricting the amount of food you take in a period of time. So you're eating only for 3 hours, 6 hours, or 8 hours, depending upon what you would want to go ahead with, right? So yes, you can do intermittent fasting, but it is only for a shorter period of time. And then you need to move on to other means to maintain your weight, like, including physical activity like running, jogging, cycling, swimming, anything you want. But then that should be used to maintain weight. It is not advisable for a prolonged period of time. One thing that I would definitely go against keto diet in women is that most of the studies have mentioned that, keto diet is not very, very helpful in women because of the, hormonal changes that they do go through. And especially if in obese women, if they are, insulin resistant or if they are diabetic, then keto diet is definitely not for them. So just touching upon keto diet too.
Thank you so much, ma'am, for answering all our questions. As we draw near to the conclusion of our session, we extend our heartfelt gratitude to each and every participant for their active engagement and invaluable contributions throughout this event. We trust that the insights and discussions shared today have equipped you with valuable knowledge and actionable strategies applicable to your respective domains. A special acknowledgement goes out to our esteemed speaker, whose expertise and insights have greatly enriched this webinar. Your contributions have been pivotal in making this event a resounding success. As we wrap up, we encourage you to stay connected with us for future events, continued discussions, and opportunities for collaboration. Thank you once again for being a part of the 2050 healthcare community, with you in every step of healing. Thank you.